Broadcasting from the business capital of the world, this is the Podcast Business News Network. And welcome back, everybody. This is the portion of our show where we put the spotlight on individuals that go above and beyond in helping others within their career, making life better in whatever way that can be done, making life better for others. This gentleman has spent decades of his career changing the face of healthcare in the greater Boston area. And that turned into a company called Healthcare Value Management. He was the president and co-founder, worked with lots of unions to make healthcare better, especially for women. And he just continues to keep on plugging along there in supporting our communities. He's our Centurion recipient, Charles L. Donahue Jr. How's everything going with you today, Charles?
Fine, Stephen. Great. And how are you doing yourself?
Fantastic. And it's good to have you back here. One of the things that stands out for many of us is you being instrumental with your wife in putting together this program of material for students and setting it up in libraries in and around your community. Could we go back to that? And I also want to focus on how the rest of us can give back and do something maybe similar in our towns.
Sure. I'd be very happy to. Many years ago, about 20 years ago, I discovered a company called the Great Courses Company. It was set up by a fellow who went to Harvard Law School and got help when he was taking his final exams, where he had a DVD and he could take some exams in the courses that he was sick and he couldn't take them. And what was interesting about it is they went around the United States to all the top colleges and they asked the students, who is the best teacher at this school? And they invited those teachers, the best teachers in all of these schools, to come to Washington to do a DVD of their courses. And you could buy these courses on a DVD. Well, it just so happens the company, the Great Courses Company, that my wife and I decided this would be wonderful to give them available to students. So we bought 140 of these courses. They usually would cost about $500, but if you watch the sales, you can get them probably for $40, $50. So we got 140 of these courses, made them available to the two local libraries. In Massachusetts, they have a library sharing program where kids in other towns can borrow the courses from the libraries in this system. So there was a lot of use in certain towns among the students taking these courses. And it became a very valuable thing. At first, a lot of students wanted to know, do they get credits to take these courses? These are college courses. The name of the professor is there. The name of the course is there. And you can take them. And the interesting thing to students is, do you get credits? The bottom line is you don't get credits for taking these courses. Maybe you're in a school system that decides to give you credits. But where they could be very valuable to students is all students need to write a college essay before they go to college or have a college interview. Usually in the college interview, they ask you, what books have you read recently? That's a standard course. They ask you that. And if you can say that I've already taken some college courses, and this is the name of the course, and this is the professor, this could put you in a very important position, because the colleges think that, you're not a football player, you're not a hockey player, but this is a kid who on their own took some courses already. And they named the courses, they named the professors, and then they wrote little write-ups of what they learned. So they could be tremendously valuable to anybody applying to college that would like to discuss courses you've already taken. I'm just going to name a few courses. I'll give the phone number of the Great Courses Company. These courses they're trying to get rid of now because they're going to be making their courses available on different systems, but not be selling these courses. These are unusual prices. These are all like $500 or $600 usually. These courses I'm going to name here, a few of them, are available for $15. And you could get these courses, usually courses, most of them around 24 lectures, half an hour each lecture. So you could do it in a spring vacation. You could do it in the summertime. Grandparents could get these courses, buy them, and make them available to their grandchildren. Or parents could do it. You could do it as a family. You could do it as a student who would like to do it with other students. These are some of the ways you can take advantage of these courses. And think of the ability that you would have to discuss your interest in the subjects. And I'm just going to name a few of these courses that are available for $15. Quite a few of them are courses on the world religions. If you'd like to learn about Hinduism, at the Rhodes College, Professor Mark Musil. If you want to learn about Islam, John Esposito at Georgetown University. These are all $15. If you'd like to learn more about music, the great master, Mahler, His Life in Music. This is by a Professor Robert Greenberg, who's with the San Francisco Symphony Performances. And all of the people who donate to the San Francisco Symphony get invited in before the concerts to listen to this guy give a lecture. Another one, World Religions Buddhism. This is taught by Malcolm Ecker at Boston University. You can take, one of the courses is a museum. You can go through the Louvre in France, the famous museum there. This course is taught by Art and Aesthetics, Richard Brettel, University of Texas at Dallas. Another course that is available for $15 is Judaism, Great World Religions, Professor Isaiah Gaffin, Hebrew University. Another one, if you'd like to learn about Abraham Lincoln, the life of Abraham Lincoln, Professor Alan Gelso at Gettysburg College. Law School for Everyone. If you'd like to learn what law school is like, my daughter is a lawyer. She said, Dad, this is what you get in law school. Law School for Everyone, Professor David Horton, University of California School of Law. Another one about music, Mozart, His Life in Music. This is, again, this Professor Greenberg, San Francisco Symphony. Great World Religions, Christianity. Another one is available, simple in studying, how to raise lifelong learners. This is a course to teach you how to teach your children to love, to be learners for life. There's one on Winston Churchill, Professor Russus Fears, University of Oklahoma. Another music one, Beethoven, His Life in His Music. This is, again, available for $5. It's usually, originally it was available for well over $500. This is by Professor Robert Greenberg, San Francisco. So that's just for people, the way you get access to these. You could, if you wanted to buy the DVD, because they're getting out of the DVD business, they're going to keep their business going where they make them available for various types of things. Here's the phone number of this group called the Great Courses, 1-800-832-2412. You just tell them the courses that you want, the ones that you could ask them for a book, to get you a book of other courses that are available at $40 or $50. But you could make a set of these courses available for your local library, your local YMCA, your local Boys and Girls Club. You could give them to these groups. They could develop courses where kids could come in after school. They could go in with their basketball team. They could go with their soccer team. They could take courses together as a group. But that's just a quick update on the great courses, how you can access to them. They do have an email. It's www.the continuation great GREAT capital COURSES.com 1-800-832-2412. This would be a great contribution to a local library. Could be a great contribution to a school that would have some interest in this. But it would give kids the opportunity in their college essay, in their college interview. We know of kids who, by saying in a college interview that they've already taken a course at this school, they've got into some very 4% entrance colleges by saying that's their background, their experience. So I'd strongly encourage people to,
love it.
If you want to volunteer to donate these things, They could ask questions of you, Stephen, and we get more details later on. But these are just some that they're now getting rid of all of their DVDs that you can buy. All the DVDs always would be there. It can be shared with various programs.
Thank you so much, Charles, for sharing that. And many computers, a lot of them have DVD players still in them. So, for anybody that says, well, I don't have a traditional DVD player in my home entertainment setup. No, you're probably doing your computer or one of the older ones. And just think of how much you're saving and how much you're getting in terms of information and schooling. I want to ask you, you made your life's work giving back to others, making things better, taking something like healthcare and making it better. How does that make you feel inside when you do those kinds of things, or you've changed the way things are being done to make them better?
Well, it's a great feeling to share with people things that you've discovered that they haven't discovered yet, that they may like to take one of these DVD courses, to hear people who said, thanks so much for making it available at the library. Thank you for explaining that even though I don't get college credit and I have AP courses and I'm really busy as a student, you've made it very worthwhile for me to do this. I will have a college interview. I will have a college essay someday. My guidance people aren't telling me about this. You've made it much more helpful to me. So it's a great feeling to share something that you've discovered that other people haven't discovered yet. Make it available. We share it with a lot of towns who borrow from the Westwood Library and the Norwood Library where they exist. So it's a great feeling to share these things with people and to help them get a little bit better at presenting themselves to a college they may want to go to.
If you could do anything right now, and I'm going to pivot over to healthcare for just a moment, what would you do to change something within the healthcare system? Whether it's insurance, whether it's the way care is administered. We have Charles' magic wand, and we can do anything we want right now. What would it be?
Well, there's some real problems with the health system in the whole United States. I feel very lucky to be in Massachusetts because a lot of changes have occurred in Massachusetts that Obama heard that Mitt Romney and Ted Kennedy agreed on a healthcare system up in Massachusetts, that they had introduced this. That became Obamacare. That became the Affordable Care Act. A lot of innovative things happened with friends of mine volunteering, pushing for some of these things. Many years ago, people who had health insurance, they had bought it all their lives, they were told by their insurance company that because of a pre-existing condition, their health insurance was no good for their cancer or whatever they had. So there was a group in Massachusetts that people went to and they said, I don't think this is fair. This group would sue the insurance companies and would win. They finally took that idea to the legislature in Massachusetts, and they passed a law that said this pre-existing condition, not allowing people to have this, became illegal in Massachusetts. When Mitt Romney and Ted Kennedy passed their health plan for Massachusetts, pre-existing conditions was illegal as a part of that health plan. When it went national with Obamacare, it became illegal nationally. Most people didn't understand that. They didn't know that that was illegal. So a lot of states with the insurance companies had really, shafted the people, who was now declared illegal. So a lot of innovative things and creative things were done. So there's a lot I could go through of people who stepped out of their usual path and usual job as a doctor or as a nurse and made big changes. Right now, there's a problem in the health system in that a lot of kids go to medical school and they want to become specialists. We need a lot of primary care doctors. We don't need a lot more specialists. There's an excess of specialists. They like to be specialists because they get paid twice as much money as a primary care doctor. They might make $400,000 or $500,000. Primary care doctor makes $2,000 or $3,000. they add to the cost of the health system. Every time you go to see somebody, it's a very expensive physician. But what some countries have started to do, they've got the federal government or the state government to say, we will give you a free medical education. It will cost you nothing if you just require that you will be in primary care medicine for at least 8 years. Then you can do whatever you want.
Wow.
So they've created an incentive by giving them a free medical education to get the types of doctors that we need, who maybe make $200,000 a year. So that's a possible solution for state governments to come up with somebody writing the legislation that says we're going to give you free medical education if you become a primary care physician. Massachusetts had a big debate a number of years ago. We had 3 medical schools in Massachusetts, and people wanted to have a 4th. A lot of people said, we have enough medical schools. We don't need any more. The argument why they get a new medical school was we need more primary care doctors. All the doctors at the medical schools we have all want to become specialists. We want to get doctors who want to become primary medical care people. So they did a search nationally for anybody that was involved in teaching primary medical care. So there was a physician, the only hospital or any medical school in the country was University of Kentucky. They had a family medicine department. They respected it so much it was equal to surgery or medicine in any other department. The physician who ran it was trained in New York by a very famous physician who once was hired by the federal government to study the American Indians and what they needed. The American Indians had real health problems. So this doctor, Walsh McDermott, who did this study, had a student named Hugh Fulmer, who was at the University of Kentucky. Massachusetts hired him to come to Massachusetts and to set up this department of family medicine. He agreed to come. They were late getting the school built, so he was without a job for about a year. Because he had some time on his hands, he went into the Peace Corps to take care of the Peace Corps volunteers. He went to the country that I was at, Malaysia, and he took care of eye health. I was in the hospital for 3 weeks on an IV for 2.5 weeks. I met him, got to know him very well, became good friends, and when I came back to Massachusetts, I kept in touch with him and worked with him for a number of years. University of Massachusetts, after a while, didn't like everything he was doing. He went to the Carney Hospital, the hospital with the largest preventive medicine residency program in the United States. He trained the commissioners of health in California. He trained all kinds of important people who believed in family medicine, primary care. So I continued to work with him. I've worked with him for many years. He was on my board of directors. I was on his board of directors. But that's what we desperately need is primary care doctors. Maybe an incentive, free medical education. Maybe that's the incentive we need. But that's probably one of the greatest weaknesses we have in our healthcare system right now. We're training too many doctors who are specialists, much more than we need. And they're doing it because they get paid a lot more money, and that's what you go for in medical school. You're paying a fortune to get your medical education. You want to come out of it with the greatest possible reimbursements, with it being the specialist. You're in the suburbs. You're where the insurances. So that's one of our weaknesses right now. And there's a possible solution. If state legislators and state government would give away medical education free if you go into primary medical care, that's a possible solution to get the types of doctors and nurses that we need who go into primary care.
Thank you for saying that. And it just makes so much sense when you think about the situation whenever you just want to go to a doctor. The waits are long because there's a shortage of them. Fortunately, sometimes you can see the nurse. Maybe it's a certain practitioner. But even when it comes to education in general, for example, in the state of New York, I believe they have something called the Empire Plan, where they will take care of most of your state education if you stay in the state of New York a period of time, 5 years, 8, something like that, because they just want to build up the economy and the workforce. But yeah, we need to take a look at that, because you're looking at it down the road. We have some serious challenges here when it comes to healthcare.
Yep, we have. There was a wonderful article I could summarize for you in the New England Journal of Medicine recently, and it was called "Failing U.S. Health System." The United States compared with 10 countries around the world: Australia, Netherlands, England, France, Germany, all developed countries. We have the lowest life expectancy. In other words, our people, men and women, live the shortest lives compared to all these countries. That's one issue. The deaths could have been handled better by preventive medicine. We have very high rates of hypertension, diabetes, cerebrovascular, ischemic heart, renal failure. We do poorer than all these countries in a lot of these preventable issues. We have an excess of high mortality from COVID-9. People younger than 75 years old, we had much higher death rates than other countries. We also have the highest death rates due to self-harm, suicide. We have the highest assault record, gun violence. These other countries don't have anything near our gun violence. And then we have very, very sporadic health insurance. There are some states that have pretty good health insurance. There's about 12 states that don't allow, they don't have Medicaid, which Massachusetts and other states realized if you allow more people to have Medicaid, it costs about $8,000 or $9,000 a year for prevention services for Medicaid, prenatal care and things like that. The federal government reimburses you 90% of your cost of Medicaid. So it's a fantastic deal for getting the federal government to help support you. There's a lot of high-risk women in prenatal care if they get that through Medicaid. But there's altogether there's about 14 states that have not included Medicaid. So we have health insurance sporadically. We have infant mortality rates in some states that are like developing countries. Massachusetts is very proud to have one of the lowest infant mortality rates in the country, one of the lowest maternal mortality rates. But you can go on Google and look at infant mortality rates by state, and you won't believe the wide differences in the infant mortality rate by state. And usually it's the states that don't have access to Medicaid that have the very high infant mortality rates. The same 14 states that don't give people access to Medicaid that have the high rates. So there's a lot that we could do to improve our quality of health insurance among some of these other states that just don't believe in giving access to certain people. So there's a lot that could be done, and I think starting off with a lot of primary care doctors that are out there who have an incentive and are proud to be primary care doctors could be the beginning of some of the improvements that we need.
Well, certainly an eye-opener in the times we've talked, and even just a few moments ago, about prenatal care and how it is essential, not only for the health of women and their babies, but also for healthcare in general. A lot of things you identified that I think many of us weren't aware of, and this is all based on research and studies that you've done over the years. Charles, it's always a pleasure having you on the show here, learning about all of this, and certainly with the programs that are available for libraries and individuals now, so much less cost when it comes to a DVD and picking that up. And might add, this is the best of the best in terms of the teachers that are delivering these courses. Really appreciate you, and thank you so much for being here again today.
Stephen, always a pleasure to talk with you.
You too. We'll be right back.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Hey, Dad, how do airplanes fly? What's in this box? Can I touch this? Where does sand come from? Is this tree good for climbing? What happens if I mix these two things together? How are babies made? What does this thing do?
Kids are curious about everything, including guns. Talking to them about gun safety in your home is a good first step, but you can do more. Always keep your guns locked, unloaded, and stored separately from ammunition. Storing your guns securely is the best way to prevent family fire, including unintentional shootings. For more information on safe gun storage and ways to keep your family safe, visit endfamilyfire.org. That's endfamilyfire.org.
What do we keep in the attic? What's this thing called? Can I ride my bike backwards?
Like I said, kids are curious. It's up to us to keep them safe. Brought to you by End Family Fire, Brady, and the Ad Council.